Spinal motion restriction is a new skill. The goal of this is to make everyone more aware of the nexus criteria, which is the criteria that we have listed on our spinal motion restriction protocol. So the first thing you're going to do is, obviously you're going to take C-spine on the patient. You're going to determine if there's a high-risk situation involved, such as an ejection from a vehicle, motorcycle crash greater than 20, auto versus pedestrian or bicycle greater than 20, axial load to the head like a diving injury, or a fall from 3 times the patient's height. If any of those are present, we're going to apply a C-collar. Then you're going to move on and assess for competency and reliability. So the patient has to be at baseline level of concentration or competency. They have to have no evidence of clinical intoxication. Now, clinical intoxication and drunk are 2 different things. No distracting injuries, so we can't have a femur sticking out of someone's leg because that's going to distract them from having any neck pain. And then unable to communicate adequately to determine if we do have any of those complaints. If any of those are present, let's apply a C-collar. Assess for point tenderness down the midline of the spine, and then also assess your PMS in your distal fingertips and distal toes, and then move on from there. If any of that's present or you have issues there, then you're going to apply the C-collar. When you do the C-collar itself, what we're going to do is measure. So from the jawline to the trapezius, we're going to figure out how many fingers width we are. Then we're going to come up from the base of the neck of the C-collar to the top of that black line on the sizing line right there on the side of the C-collar, and that's going to be our size. So how is a tall? Maintaining C-spine, someone's going to hold C-spine. We're going to guide the collar underneath the back of the head and apply it as you normally would. Reassess your PMS after you've applied the C-collar. A couple of questions. Is it going to ask how to move the patient, if they're ambulatory or non-ambulatory? So if the patient is ambulatory, you're going to assist them to standing. You're going to have them stand up, maintain a neutral alignment, walk to the cot, turn, sit, and lay down with assistance and neutral alignment. If they are non-ambulatory or they have pulse motor deficits, we're going to head and remove them with a KED or remove them with a spine board, and then place them on the cot and make sure we remove the spine board when we're done. Last couple of questions is you can raise the head of the cot up 20 degrees. So you might be asked that. And if the patient is vomiting, we're going to use multiple people. We're going to log roll over and suction the mouth as necessary for vomiting.